Hello everyone, I am Mrs. Priyanka Charan, psychologist working at Tulsi Healthcare, and today the topic that we are going to talk about is bipolar disorder. Bipolar disorder is a mood disorder, a mental health condition that causes dramatic shift in individuals' energy levels, mood, thoughts, behavior, ability to concentrate and think. This mood shift creates disruption in daily functioning, also day-to-day interactions. Thing that sets bipolar apart is the experience of extreme mood shift from a high to low. There are three types of bipolar: bipolar 1, bipolar 2, and cyclothymic disorder or cyclothymia. Generally, a person suffering from bipolar will experience mania, hypomania, depression, or both depending upon the severity of the symptoms. Symptoms of mania. A person experiencing mania will have high energy levels, disturbed sleep, distractibility, high self-esteem, too much optimism, and in full-blown mania, this can reach a dangerous place where an individual can have reckless behavior, risky and impulsive decision making. They can feel pressured speech where they talk continuously due to repetitive, rapid thoughts. Also, they can have delusion or idea of grandeur where they believe they have certain special powers, supernatural powers, or they are on a mission by God themselves. Symptoms of depression. Individual experiencing depression will feel extreme sadness, low energy level, increased sleep, poor appetite, too much of fatigue, crying spells will be there, decreased ability to concentrate, think, self-harm attempts or suicidal ideation. Thing in bipolar that differentiate is the duration and the onset along with symptoms. Generally, bipolar onset is in late adolescence and early adulthood, but it can be triggered at any given point in an individual's lifetime. Let's understand these bipolars. Bipolar 1 is a disorder where there must be one episode of mania followed by an episode of hypomania or depression. Generally, mania lasts for 7 days and can be so severe that individual might require hospitalization. Generally, people experience episode of depression, but many people have an episode of mania without any depression. Bipolar 2. Bipolar 2 is a condition where there must be one episode of major depression and one episode of hypomania which never reaches to a full-blown mania. In hypomania, the symptoms are similar to mania but less severe and last only up to 4 days. Major depression can last up to 2 weeks. Cyclothymic disorder or cyclothymia. Cyclothymia is a condition where an individual will experience hypomania and depression, but they never reach a full-blown mania or a major depression. In adults, it should be present for at least 2 years, and in children and adolescents for 1 year. It can typically have an onset of as early as 6 years and may develop into bipolar 1 or bipolar 2. Individuals with bipolar may also show some rare symptoms of mixed episode where they experience depression and mania at the same time. A rapid cycling is a phase where they will have 4 or more episodes of mania or depression within an year. People with bipolar also are vulnerable to other psychiatric or mental health diagnoses like psychosis, anxiety disorder, eating disorders, substance use disorder, and personality disorder. Let us understand why bipolar happens or what causes bipolar. Like many mental health conditions, the exact underlying cause for bipolar is still unknown, but genetic, biological and environmental factors lead to the onset of bipolar. Someone who has a family history of bipolar will be more likely to have bipolar. Stress, substance use, and conflict are environmental factors that can cause bipolar. Certain medication and drugs lead to mania. It is a lifelong condition, but timely treatment and right diagnosis can help reduce and manage symptoms. Treatment of bipolar will be a combination of medication and therapy. Your psychiatrist, your doctor may ask you to be on mood stabilizers, antidepressants, anti-anxiety medicines, antipsychotics, or combination of these medicines to manage your mania, depression, sleep and anxiety. Therapy is a way where you have a safe space with your mental health professional to talk about your mood, your behavior, your thoughts and feelings. Certain therapies that have helped in bipolar are talk therapy, which helps you to ventilate and speak in a safe environment; cognitive behavior therapy to identify your negative thoughts and build coping; dialectical behavior therapy, which helps in distress management, emotional regulation and mindfulness; family therapy to help resolve family conflict and build insight in the family about the illness. Support groups and psychoeducation is another way where you can find help by sharing your experiences with people who have similar symptoms and build insight by learning more about your illness. Bipolar is a lifelong condition. With right treatment, right help, do not be afraid. Seek help, reach out to your doctors. In India, you do have lot of psychiatric help available like Tulsi Healthcare, Fortis, Max and many more. Seek help and help yourself and someone you know with bipolar live a healthy, meaningful life. Thank you.